Hey everyone, welcome back to the channel. Today, we're diving into a crucial topic that could literally save your life or the life of someone you love. We're talking about strokes. Now most of us know the immediate signs, but what about the warning signs that show up days before? We're going to break down the 5 stroke signs that often appear up to 3 days before a stroke happens. And pay close attention, because we're going to talk about why most people over 65 tend to ignore number 4. And trust me, you don't want to miss this. Knowing these signs and acting quickly can make all the difference. So, let's get started. The first sign we're going to talk about is a sudden, severe headache. This isn't just any headache, it's one that can strike without warning and with a level of intensity that can be quite alarming. And I'm not talking about your typical tension headache after a long day. Those are usually manageable with some rest or over-the-counter pain relief. This is a headache that hits you seemingly out of nowhere, and it can be incredibly intense, like the worst headache of your life. Imagine a pain so severe that it stops you in your tracks and makes you wonder if something more serious is going on. Now, headaches are incredibly common, right? Most of us have experienced them at some point, whether due to stress, dehydration, or even just staring at a screen for too long. So how do you know if this is a stroke headache or just a regular headache? It's a crucial distinction to make because the consequences can be life-altering. Well, this type of headache is often described as throbbing or pounding, and it might be focused on one side of your head. This unilateral pain can be a significant indicator that something more serious is happening. It can also be accompanied by other symptoms like nausea, vomiting, or sensitivity to light and sound. These additional symptoms can make the headache even more debilitating, and are often a sign that you need to seek medical attention. The reason this happens before a stroke is actually pretty fascinating. It's all about the blood flow in your brain and how it's being disrupted. You see, a stroke occurs when there's a disruption of blood flow to the brain. This can happen for a variety of reasons, but the result is always serious. This disruption can be caused by a blockage in a blood vessel, which is called an ischemic stroke, or by a rupture in a blood vessel, which is known as a hemorrhagic stroke. Both types of strokes can lead to severe consequences if not treated promptly. In the days leading up to a stroke, the affected blood vessels might start to narrow or become damaged, and this can cause changes in blood flow that trigger this intense headache. It's like your brain is sending out a distress signal. It's your body's way of trying to tell you something's not right. Ignoring these signs can be dangerous, so it's important to pay attention to what your body is telling you. So if you suddenly experience a headache that's different from any you've had before, especially if it's severe and comes on suddenly, don't ignore it. This could be your body's way of alerting you to a serious issue that needs immediate attention. It's crucial to seek medical attention right away, especially if you have any other stroke risk factors. Early intervention can make all the difference in outcomes, so don't hesitate to get help. The second sign you need to be aware of is dizziness, or a sudden loss of balance. This isn't just a minor inconvenience, it can be a significant indicator of a serious health issue. Have you ever felt like the room is spinning, even though you're standing perfectly still? This disorienting sensation is more than just unsettling. That's vertigo, and it can be a warning sign of a stroke, especially when it comes on suddenly and without a clear explanation. Vertigo can make you feel like you're moving when you're not, and it can be accompanied by nausea or vomiting. You might feel unsteady on your feet, like you're about to fall over. This sensation can be incredibly frightening and disorienting, making it difficult to perform even simple tasks. This loss of balance can be particularly dangerous because it increases your risk of falls and injuries. Falls are a leading cause of injury among older adults, and they can lead to serious complications. Now, dizziness and loss of balance can be caused by a variety of factors, including inner ear problems, dehydration, or even certain medications. It's important to consider these possibilities, but also to be aware of the more serious implications. But when these symptoms occur suddenly and are severe, or if they're accompanied by other stroke symptoms, it's essential to seek medical attention immediately. Time is of the essence in such situations. Think of it this way. Your brain is like the control center of your body, right? It manages everything from your movements to your thoughts. It receives information from your senses, including your sense of balance, and it sends signals to your muscles to help you stay upright and coordinated. This intricate system works seamlessly to keep you steady. When blood flow to the part of your brain responsible for balance is disrupted, it can throw off this delicate system, leading to dizziness and loss of balance. This disruption can be a critical sign of a stroke. So, if you're experiencing sudden dizziness, vertigo, or difficulty maintaining your balance, don't brush it off. These symptoms are your body's way of signaling that something is wrong. It could be your body's way of warning you about a potential stroke. Always take these signs seriously and consult a healthcare professional to ensure your safety and well-being. The third sign we're going to discuss is sudden vision changes. Now, we all know that our eyesight can change gradually over time, especially as we get older. But sudden vision changes, especially in one eye, can be a red flag for a stroke. You might experience blurred vision, double vision, or even a complete loss of vision in one eye. Some people describe it as a curtain coming down over their field of vision. These vision changes can be temporary or permanent, depending on the severity of the stroke and how quickly treatment is received. Here's why this happens. The visual pathways in our brain process the information sent from our eyes. When a stroke occurs, the blood supply to these visual pathways can be compromised, leading to disruptions in visual processing and the sudden vision changes we've been talking about. So, if you notice any sudden changes in your vision, don't wait to see if they go away on their own. Time is of the essence when it comes to stroke treatment, and early intervention can make a world of difference in preventing long-term damage. Now we're getting to sign number 4, and this one is so important, especially for those over the age of 65. As we age, our bodies go through numerous changes, and it's easy to dismiss certain symptoms as just part of getting older. However, some signs should never be ignored. We're talking about numbness or weakness in the face, arm, or leg, typically on one side of the body. This isn't just a minor inconvenience, it can be a major red flag. This is a classic stroke symptom, and it's often one of the most noticeable signs. Strokes can happen suddenly and without warning, making it crucial to recognize these symptoms immediately. You might feel like your face is drooping, or you might have trouble smiling. This facial drooping is a clear indicator that something is wrong. You might experience weakness in your arm or leg, making it difficult to lift objects or walk normally. Everyday tasks can suddenly become challenging. Some people describe it as a feeling of heaviness or a pins and needles sensation. This can be particularly alarming if it comes on quickly and without any obvious cause. Now, here's why this sign is often overlooked by seniors. Many older adults tend to downplay these symptoms, thinking they are just part of aging. As we age, it's not uncommon to experience occasional numbness or tingling in our extremities. This can be due to a variety of reasons, such as sitting in one position for too long or minor circulation issues. We might attribute it to arthritis, poor circulation, or simply getting older. These are common issues that many seniors face, but they shouldn't be used to explain away sudden severe symptoms. But when these symptoms come on suddenly and are accompanied by other stroke signs, it's crucial to recognize that it's not just old age, it could be a stroke. Immediate medical attention is necessary to minimize damage and improve outcomes. The reason this numbness or weakness occurs is that a stroke disrupts blood flow to the part of the brain that controls movement and sensation in the body. This disruption can have serious consequences if not addressed promptly. When this part of the brain is deprived of oxygen-rich blood, it can't function properly, leading to these neurological deficits. Recognizing these signs and acting quickly can make all the difference in a stroke situation. The fifth and final sign we're going to cover is difficulty speaking or understanding speech. This is another common stroke symptom that can manifest in different ways. You might find yourself slurring your words, or you might have trouble finding the right words to express yourself. This is known as aphasia, and it can be incredibly frustrating for both the person experiencing it and their loved ones. In some cases, you might be able to speak clearly, but you might have difficulty understanding what others are saying to you. This is called receptive aphasia. On the other hand, you might be able to understand what others are saying, but you might have trouble expressing your own thoughts and ideas. This is known as expressive aphasia. Communication is such a fundamental part of our daily lives, so when a stroke affects our ability to speak or understand language, it can be incredibly isolating and debilitating. The reason this happens is that the areas of our brain responsible for language processing are highly sensitive to changes in blood flow. When a stroke occurs, these areas can be damaged, leading to the language difficulties we've been discussing. So, there you have it. The 5 stroke signs that can show up days before a stroke occurs. Remember, time is brain. If you or a loved one experience any of these signs, don't hesitate to seek medical attention immediately. Call 911 or get to the nearest emergency room as quickly as possible. Recognizing these symptoms early and getting prompt medical attention can make all the difference in stroke outcomes. It can mean the difference between recovering fully and living with long-term disabilities. So, be aware, be informed, and don't hesitate to act if you suspect a stroke. Thanks for watching, and don't forget to like, comment, and subscribe for more health tips and information. Until next time, stay healthy.